welcome to Medical Dialogues. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Last study suggests no adverse effect of fertility treatment on cardiovascular health of offspring. A last study looking at the effects of fertility treatment has found no robust difference in blood pressure, heart rate, lipids and glucose measurements between children conceived naturally and those conceived using assisted reproductive technologies or ART. The study sought to address concerns around whether fertility treatment leads to adverse cardiometabolic health in offspring. The data sample included 8,600 children from Bristol's Children of the 90s study, which has followed pregnant women and their offspring since 1991. Since the first birth of a child by in vitro fertilization or IVF, questions have been raised about the health risks to children conceived this way. However, previous studies are limited by small sample size, short follow-up, and unsatisfactory comparison groups. The study looked at data from 35,000 European, Singaporean, and Australian offspring. It was large enough to study whether conception by ART affected blood pressure, pulse rate, lipids, or glucose from childhood to young adulthood up to early 20s. Novel cell death mechanism may hold potential for novel cancer treatment strategies, says study. A study from researchers at the University of Texas MD Anderson Cancer Center details a previously unexplained type of cell death called disulfidetosis that could open the door for novel cancer therapeutic strategies. Many cancers, such as lung cancer and kidney cancer, have an overexpression of SLC7A11, which codes for the cysteine transporter. The SLC7A11 protein encodes cysteine, an important amino acid that can contribute to tumor growth. But elevated levels of cysteine and other disulfide molecules can be toxic. To regulate this balance, cells are forced to use the molecule NADPH to quickly convert toxic disulfides into other non-toxic molecules. Now, NADPH is mainly supplied from glucose, so cutting off the glucose supply can lead to an accumulation of disulfide molecules and cell death. Study finds hope for ovarian cancer patients in new immunotherapy. CAR T-cell therapy, a certain kind of cancer treatment in which the immune system's T cells are programmed to attack tumor cells, is effective in mice with ovarian cancer, according to the study published in the Journal for Immunotherapy of Cancer. The researchers hope that the discovery will pave the way for a clinical trial to see how effective the treatment is for women with the disease. Now, CAR T-cell therapy is a relatively new type of immunotherapy that involves extracting a patient's immune cells, known as T cells, from the blood and injecting them in a lab with a new gene that specifically attacks a molecule called a chimeric antigen receptor or CAR on the surface of the tumor cells. When returned to the patients, the T cells are more aggressive and attack the cancer cells like guided missiles. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.